I recently treated myself and upgraded my Apple Watch with a stainless steel bracelet watch band that is so gorgeous that my husband seriously thought I'd spent a fortune and made comments about my watch bling. What he doesn't know is I got this gorgeous and elegant watch band from Quince for $50. And that's the thing about Quince. Elevated looks, high quality, and timeless style, all for way less than what you'd expect. And they have pulled out all the stops for fall. 100% Mongolian cashmere starting at just $50, washable silk tops and skirts, perfectly tailored denim, and the most beautiful wool coats. Everything looks designer level, but costs a fraction of the price. Quince makes this possible by partnering directly with ethical top-tier factories and cutting out the middleman. That means you get luxury quality staples at about half the price of similar brands. Keep it classic and cozy this fall with long-lasting staples from Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo. Quince.com/nursemo. Hi there, I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. Today, I'm sharing with you two very important lab tests that you definitely need to know whether you're a student or an actual bona fide working nurse. And before we hop into those, let's take a quick minute for our listener shout out, which goes out to Catherine, who has been using Study Sesh. And here's what she says. I'm a second semester nursing student and I love to listen to podcasts, so this style of learning really spoke to me. After listening to a few cardiac study sessions, I'm 100% sold. So awesome. I can listen in my car, put headphones on, and study while exercising or even cleaning. Catherine, thank you so much for sharing your experience with Study Sesh. I'm thrilled that the podcast helps you and that Study Sesh helps you, especially as you're trying to do more with your life than just sit at a desk. And that's why I made this podcast. That's why I made Study Sesh, so that students didn't have to sit and stare at a screen all the time, because I don't know about you, but that's really boring to me. So thank you, Catherine. And if you're wondering what Catherine is talking about when she mentions Study Sesh, that is a private podcast that I have that includes pod quizzes, which are like doing flashcards for your ears, among some other styles of lessons. I'll put a link to that in the episode notes. Alrighty, let's dive into this. We're talking about two of the most common cardiac labs that you will need to interpret for exams or in the clinical setting, and that is the BNP and Troponin. So whether you're prepping for an exam, heading into clinical, or just trying to make sense of labs as they're being rattled off to you during report, this episode is going to help you feel more confident interpreting these values and knowing what they mean for your patient. So first up is BNP. So what is it and what does BNP stand for? So BNP stands for B-type natriuretic peptide. Now, you may also see it referred to as brain natriuretic peptide, and this has to do with, I believe, the fact that it was first discovered in a pig brain, so they called it brain natriuretic peptide. But it is now more commonly referred to as B-type natriuretic peptide, which is really hard to say, so we're just going to say BNP. And this is a hormone that is released by the ventricles of the heart in response to increased stretch. So where do you think that increased stretch comes from? It stems from volume expansion and pressure overload on the ventricle, most specifically the left ventricle. And that is why you will see BNP come into play when a patient in heart failure is experiencing fluid overload, okay? Or anytime that heart is experiencing fluid overload, maybe it's like an acute exacerbation, that BNP is going to go up. So BNP very closely related to heart failure. So what is a normal BNP level? Typically, normal is going to be less than 100, and that is measured in picograms per milliliter. picograms, tiny, so less than 100. And if that level is elevated, it suggests that the heart is struggling to manage the volume it's got on board and is indicative of congestive heart failure. The higher the BNP, the more severe the CHF. So let's look at the clinical significance of BNP. Let's say you've got a patient experiencing shortness of breath. Now, the BNP can help determine if the cause is related to congestive heart failure or if it's possibly something else. So, for example, let's say your patient, they're short of breath, their BNP is elevated. The cause of that shortness of breath can more or less be attributed to a CHF exacerbation. But if that BNP is normal, then that shortness of breath is due to another reason, such as anemia. Maybe they're very anemic or they have a lung infection like pneumonia. So that's one way that we can use the BNP in a clinical situation. Now, it's also and very commonly used to monitor a patient's progress. If a patient with CHF has an elevated BNP that does not pretty quickly return to baseline with treatment, this is an indicator of significantly higher mortality risk from those CHF and its complications in the coming months. However, a patient whose BNP is elevated, they come in, they get treatment, and it returns to baseline, they're likely to have a better outcome. So you can look at that BNP and kind of see how they are progressing as far as their treatment goes. However, an elevated BNP does not automatically mean, oh my gosh, Bob has heart failure. There are other causes for an elevated BNP, so you do have to look at the whole clinical picture and how the patient is presenting. So some other causes for an elevated BNP include renal failure, myocardial infarction, which can lead to heart failure, systemic hypertension, especially like prolonged systemic hypertension, heart transplant rejection. I feel like that would be a really good test question. Liver cirrhosis, sepsis, COPD, and pulmonary embolism. So kind of a lot of reasons why BNP could be high that are not related to heart failure. So again, you really do need to look at the whole clinical picture and what is happening with your patient. Now, you can also have falsely low levels of BNP. This can occur due to obesity. It can occur due to certain medications such as ACE inhibitors, beta blockers, and diuretics. So that was BNP. When you hear BNP, think heart failure, even though there's other reasons for it to be high. The reason we're following it, like doing daily BNPs on a patient, most likely because they're in heart failure and we are watching to see how they are progressing. So we'll hop into troponin after this quick message. I recently treated myself and booked a deep cleaning through Homoglow, and wow, my cleaner was prompt, polite, and so thorough. She even tackled my oven, and I am here to tell you that that thing looks brand new. Having that kind of support is huge for me. A clean home makes me feel calmer, more productive, and frees up time for what actually matters. And that's why I'm so proud to have them as a sponsor of my show. Now here's how it works. Homoglow is a top-rated home service platform dedicated to making your space clean and tidy. Just go to their website, choose the day, time, and duration, and you're instantly matched with the cleaner. You can schedule as soon as this week and get one thing checked off your to-do list right away. You'll even see photos and reviews of background-checked cleaners before booking. Their Forever Clean membership is the best part. You'll save $30 an hour on all future cleanings with unlimited bookings starting at just $19 an hour, all backed by their happiness guarantee. Take home cleaning off your plate with Homoglow. Head to homoglow.com/nursemo to get your first 3 hours of cleaning for only $19. That's HOMEAGLOW.com/nursemo. If you've ever wondered, did I just hear a murmur? Or struggle to catch subtle sounds in a noisy environment, you know how tough it can be. That's why I love my Echo Core stethoscope. As a nurse educator, accuracy is everything. I need to teach with confidence. Echo makes that possible. It amplifies heart and lung sounds up to 40 times, filters out background noise, and with Echo AI, you can detect murmurs and atrial fibrillation earlier. You can even record and share sounds and collaborate easily. Backed by 8 FDA clearances and millions of heart sounds, studies show that clinicians using Echo are twice as likely to detect heart disease. Honestly, it's like having a second set of expert ears right in your pocket. I trust Echo so much that I work with their team to create a special offer just for my listeners. Right now, you can get up to $50 off plus a free customizable chest piece cover at echohealth.com/nursemo. Your purchase may be HSA and FSA eligible and may qualify for CEUs. Plus, Echo guarantees you'll detect heart and lung conditions more confidently. If you don't, return it for a full refund. Go to echohealth.com/nursemo for up to $50 off plus a free chest piece cover. That's ekohealth.com/nursemo. So troponin is a cardiac biomarker that gets released when heart muscle is damaged. This makes it a very, very important lab test in working up a patient with suspected or confirmed myocardial infarction. There are two main types of troponin, troponin I and troponin T. Now, of the two, troponin I is more specific to cardiac tissue. So that is the one that is generally evaluated in the clinical setting when myocardial infarction is suspected. Now, however, both troponins may be tested to give a more comprehensive picture. So just be aware that if you see both troponins, I and T, on your lab result, the one that's more specific to cardiac tissue is going to be troponin I. So now you're probably wondering, well, what is a normal troponin level? So a normal troponin I level is less than 0.03 to 0.04 nanograms per mil. Now, I saw both of those listed, so I wanted to make sure you had both numbers, 0.03 to 0.04. We want it underneath that for normal. But here's what happens when a patient has a myocardial infarction and that myocardial cardiac tissue gets damaged. That troponin I level will begin to rise about 2 to 3 hours after the onset of chest pain, when the cause of the chest pain is because of a myocardial infarction. And that level will continue to rise until it peaks in 12 to 48 hours. And then it will slowly decline over a period of 4 to 10 days or so. Now, because it takes a few hours for the troponin to elevate and up to 48 hours for it to reach its peak, what you will often see in most cases is serial troponins. And when we say something is a serial lab draw, it means we're doing it repeatedly every 4 hours, every 6 hours, every 8 hours. So you will see serial troponins every 4 to 6 hours, sometimes every 8 hours, as that patient is being evaluated for myocardial infarction. So now that you have an understanding of BNP, of troponin, let's talk through a few clinical examples of these cardiac labs so you can kind of see how it would come into play with your patient's plan of care. All right. So when you say or hear somebody say, Mr. Wilson has a BNP of 1800 and is on a furosemide drip. His urine output has picked up and his weight is down a kilo since yesterday. I expect his next BNP to be considerably lower. What is the clinical significance of that? What are we understanding about what is happening with Mr. Wilson? So BNP is 1800. He's on a furosemide drip. His urine output has increased. His weight's down a bit. We expect his BNP to be lower on this next draw. What the clinical significance of this is that we're showing that we understand that we must watch that BNP trend with treatment so we can see how well Mr. Wilson is responding to treatment. And because the furosemide looks like it's kicked in, right? His urine output's up, his weight's down a whole kilogram. I expect his heart isn't having to struggle so hard. I expect that his BNP is going to be down. So that would be what you might hear, a scenario that would be very common for a patient who came in with a CHF exacerbation. Okay, what about this? Ms. Miller's troponin just came back at 0.09, up from 0.03. She continues to have chest pain and is hypotensive. So we've got a patient whose troponin is trending up, right? It was 0.03, now it's 0.09. She's got chest pain and she's hypotensive. So what we're showing with this statement is that we're basically painting a picture of a patient who is experiencing active cardiac injury that MD that you're reporting to needs to take very seriously. How about this? She's in mild respiratory distress with a BNP of 2100, 2+ leg edema, and a known CHF history. We started BiPAP and IV diuretics in the ED, and she's already diuresing well. Cardiology is on board and wants her on telemetry monitoring. So you've got a patient in the ED who's going up to the floor. We are advocating for telemetry monitoring with a patient who is in mild respiratory distress, BNP's elevated, she's got the edema, she's got the CHF history, she's got the BiPAP going, she's got some diuretics, she's starting to have some progress with that, but we still want to keep an eye on her. So what we're saying with this statement is we're saying that we're using that BNP value in combination with the patient's symptoms and treatment response to justify that appropriate higher level of care. We don't want her going just to the regular med-surg floor. We want her going to telemetry. Okay, how about this one? After stent placement, his troponin has decreased for the last 3 draws. Chest pain has resolved and ECG is showing normal sinus rhythm. So what do you think's going on here? So what's going on in this statement is you're showing that you understand that a decreasing troponin is a sign that the cardiac event has passed, it's not getting progressively worse, and that the interventions we did worked. He got a stent placed. Alrighty, let's do another one. How about this? His BNP was 450 pre-op, but he's hemodynamically stable, no respiratory distress, and lungs are clear. We'll monitor closely, but there are no signs of acute decompensation at this time. So what is happening here? So with this statement, you're showing that you're not panicking over that patient's elevated BNP because his clinical picture doesn't support immediate concern, but you are keeping a close eye on this patient because you do understand that things could change. So that is your quick overview of 2 very important cardiac labs. Quick summary, BNP tells us about volume overload and is a key diagnostic tool in evaluating heart failure and response to treatment. And troponin, specifically troponin I, tells us about cardiac cell injury and is used to evaluate patients with chest pain and suspected myocardial infarction. I hope you found this episode helpful. If you did, share it with a classmate, share it with a coworker, and make sure you're following the show and that you leave me that 5-star review on Apple Podcasts or Spotify or wherever. And if you're on Spotify, you can leave comments and I read them. And that's great because then I can see that the episodes are really helping you. So I will see you again very soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Doug. Limu and I always tell you to customize your car insurance and save hundreds with Liberty Mutual. But now, we want you to feel it. Cue the emu music, Limu.
Save yourself money today.
day. Increase your wealth, customize and save, we say. That may have been too much feeling.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.